Welcome back, everyone. Our next session is with Anne Brown, whose topic is Designing Halotherapy Rooms. Anne is a 20-year spa industry veteran who has built her career helping spas increase revenue, innovate treatments for greater sustainability and increased client benefit, and establish reputations for exceptional signature experiences. Through saltability and Himalayan source, she is known as a spa industry leader in Himalayan salt concepts and treatments. Please enjoy Designing Halotherapy Rooms.
Thank you so much, Laura. Okay, I'm Anne Brown. We'll move on to the next slide. I do want to preface that I am licensed in all areas of spas. I'm still an active massage therapist, esthetician, nail technician, and cosmetologist. And I went to business school at the University of Florida and spent the last 26 years actually opening and designing resort spas for a living. And in 2014, I started Saltability, which does Himalayan salt stone massage. And I created a way to heat the stones so we didn't use water or harsh chemicals or much electricity, and the stones were hand carved Himalayan salt. And then the second company, which I partnered with an engineer because I didn't know how to build salt walls, is called Himalayan Source, and it has to do with halotherapy. So what is halotherapy? It's 100% natural and healthy. It improves breathing and it achieves relief from respiratory and skin ailments, primarily respiratory. It can clean the respiratory tract. It helps with lung function. It helps people breathe easier. It strengthens the immune system. It improves skin's health, and it increases athletic performance, which are all clinically proven. Next slide. So how does it work? Halotherapy uses a natural basic mineral, which is pure salt or sodium chloride. It's actually pharmaceutical grade. Sodium chloride is an essential element for the regulation of mucus in the lungs and for the upper respiratory system. It cleanses the respiratory tract and it strengthens lung function by stimulating the body's internal processes. Simply inhaling and exhaling while in a halotherapy room, which is a controlled environment, and we'll go into that in a minute. There's tiny negative ionized salt micron particles that will help improve your breathing and more. Next slide. So what we've done is effectively changed a little bit of how you use halotherapy, because many of you may have been in a salt cave or a retail setting where there's a halotherapy room where many people are sitting. So because of COVID-19, we innovated by turning a treatment room into a single-use salt room so that there can be an avenue to support the guest's health with particular focus on respiratory support, which is so important now, and increasing the revenue. And I want to talk about the standalone treatment. So there's no commission to be paid. You can offer it as an add-on or an upgrade in conjunction with a facial and massage, meaning if the facial or massage could be done in that specific room. So therapists who are hands-on or licensed, some of them may not want to come back to work for many reasons, and many have gone into another sector of a profession. And most therapists or licensed staff are usually second, third careers getting into massage therapy or aesthetics, so many of them are or have gone back to another profession. Sometimes the clients, the members, we do a lot with some of the membership chains, or guests may not want to be touched with a facial or massage now or in the next few months. So a salt therapy room is really for one person. There's no side-by-side chairs. So it's creating a perfectly safe environment. You could transfer in multiple seats when we have less COVID, so that multiple members or clients could be in the same setting and gain benefit from the salt therapy experience. Next slide. So we also do, most people are drawn to the Himalayan salt look, which is on the screen now and behind my screen. But the salt panels alone are purely for aesthetics. They're just to see them. People are very drawn to the pink, the hues of the pink color. It does have an effect on the brain, but for true halotherapy, which we'll go into in a minute, is really where we use a halo generator and we kind of grind up this pharmaceutical grade salt. So these salt walls and panels, if they're warmed, like in a sauna, they can help with energy or even doing some minor air purification or boosting moods. But in a setting like you're seeing on the screen, in an actual salt room, these panels would not be heated. Next slide. So if it is a warmed, so this woman is in a warmed Himalayan salt environment on the screen, which would be like a sauna, and most saunas are about 134 degrees. And in the United States, saunas are somewhat underutilized, especially in larger resort spas where there's steam or some other forms of hydrotherapy. So what we see is when we do add in Himalayan salt bricks into a sauna, it seems to be more utilized. That not only is it trendy, but it is very beneficial and people are kind of drawn to it. So warmed Himalayan salt has a cleansing effect on the air, and it can balance the relationship of negative and positive ions in the environment. It has a natural ability to absorb water from ambient air when heated, and the water and salt transformation cycle is measurable as it cleans the air. So a lot of people will ask me, gosh, you know, I have a salt lamp and I keep it by my desk or by my bed, and sometimes it perspires or I see the salt on the bottom of it. Depending on the humidity of mostly your room or the area that you live, the salt will attract that humidity, and then you'll see the sweating on mostly a salt lamp for personal use. Next slide. So we want to talk about return on investment, or ROI. So what we have here, which is small to see, but we have done a 12 by 8 Himalayan salt wall with a halo generator. So that means it does have a way to emit the salt particles into the air. So at the typical session is a little over $1 a minute. So we're looking at about $40 per 30-minute session. If we did 10 sessions a day, which would be literally 5 hours of that day, and most salt therapy rooms are open 8 to 10 or 12, and we're doing them 6 days a week. So there is one day where the spa or this halotherapy room would be closed. The salt room could be paid off in 4 weeks with 3 or 4 seats in it. So I do want to talk about how did we get the number on our salt room, which the salt room in this particular environment that we've made this Excel spreadsheet is about $34,000. That's a pretty expensive salt room. If we were doing a halo generator, which usually runs about $5,000 to $7,000, and one salt wall, which is what would be impactful, where the guests sit and look into the salt wall, that could be as little as $15,000. So we have quite a robust salt room here that would have 3 of the 4 walls done in salt, and we have a halo generator. And so it's showing the income monthly is about $11,000 in this room, and it would net income in 1 year about $100,000. Again, if we went to less than 3 salt walls, which we wouldn't recommend really, you could pay this room off in under a month. Okay, next slide. So some of our clients, we've done the Langham Place, which is a 5-star hotel in New York and Chicago. Grand Spa, this is actually in Montego Bay, Jamaica. in this room that happens to be in the spa, they have VIP cocktail parties, they have yoga sessions, they have private training, they bring in massage tables, and then they also bring in salt loungers. They have 4 large salt loungers that are heated, and they actually have hand-carved Himalayan salt on them for guests to relax. So some of these salt therapy rooms, if they're large enough, can be multi-use, where you can be using them for many things during the day. I've seen there's a new franchise model called the Salt Suite, and there's about 9 or 10 of them here in Florida or around Southeast United States, and they actually have a kids halotherapy room, which is primarily for children with asthma or bronchial inflammation. Next slide. So we've just created a salt pod. This looks very close to what we're doing. It's convenient, quick. It positively impacts the pulmonary health. No need to undress or change clothes. You can just simply sit and inhale deeply in this comfortable environment and get the benefits of salt therapy. A 30-minute salt pod session gives time for meditation. You can use your phone. You can stay in your business suit. You can make phone calls. You could conduct a Zoom meeting. You can use your time as desired, but you're breathing in the salt and getting the benefit of the pulmonary effects. The salt pod that we're making now comes in various sizes, so it does include the halo generator, and it is a small generator, so it does make a little noise. So we would put it, if you can see in the slide, it's that white kind of long oval shape. That is the actual halo generator. So the generator part is on the outside of that glass wall, and then it will grind up the salt on the outside and then kind of disperse it through on the inside. So there is a little container at the top of that halo generator where you would add a teaspoon of pharmaceutical grade salt, and then it sets the session for you. You can pick 30, 45, or 60 minutes, and it will do all the work, and it will go off on that time, and then it just needs to be filled up again. Every day that halo generator does need to be cleaned, but the salt wall has no effect because there's no moisture on the salt wall, there's no sweating on that salt wall, and it's not heated. So you can just lay, and as you can see, this salt pod is large enough for probably 4 people, but right now, most people are just using it, clients of ours are using it for 1 guest due to COVID. It comes ready to assemble. We sell it as a kit. We sell our salt walls as a kit. So what we would be looking from our guests or potential clients as the measurements of a wall. So we would know how to build the kit, and it would come with the LED lighting, pre-drilled holes. So it's really almost a carpenter type of layperson could put this salt wall up. It will come with directions. We give a couple of complimentary calls with our engineer as well. Next slide. So we're starting to do a lot of private halotherapy experience. This is actually a Hand and Stone spa in Delray Beach, which is not far from here. I'm in Boca Raton. So it's really out of the need, a couple of things. A lot of therapists are not coming back to work, so there is a shortage of therapists. So in certain models, like some of these membership chains, they can have 8 or 10 treatment rooms and only 6 therapists. So what they're doing with their underutilized treatment room, sorry, we've gone 1 slide too early. Laura, can we go back 1? Great. So this single guest experience, you can see the massage table there, and what guests are allowed to do is get into the room. They could get a massage, a facial, or they could just lay on the treatment table. We've also put additional therapies such as infrared therapy. We've done a meditation with an ear set where it's got embedded frequencies. And so all of these, it has PEMF, pulse electromagnetic field on the mat as well. So these guests are getting 4 or 5 treatments in one 30 to 60 minute session. Next slide. So this is going to talk about what we've bundled in some of these chains. We put this mat that has far infrared technology. There's Gemstone Healing, which is tourmaline, amethyst, and jade, which helps with local circulation. It relaxes your joints and pain, helps with some chronic illness. It can improve energy and mood, and it does stimulate the cells. The tourmaline, amethyst, and jade, they're good for negative ions, far infrared rays, and helping the ability for the body to reduce inflammation, nerve damage. There's also LED lights on this mat that we promote as well. There's far infrared heat, and like I said, there's pulsed electromagnetic field. So you're not only getting the halotherapy and the guided meditation, so it is truly 6 therapies in one session. And what we're trying to do is bring down anxiety, stress, and get people into parasympathetic, which is that restful, reparative state. Next slide. So this is just I just want to show you how we support in marketing and helping your client to understand. This is just a waiver so that the client gets to choose what they want, that they do want the salt therapy, they do want the far infrared, they want the pulsed electromagnetic field and the gemstone therapy, so that they can actually read what they're getting and be a little more educated about the experience, including the salt therapy. Next slide. Okay, so I am not Rachel, but Rachel does work with us at Himalayan Source. And if you have any questions, if you say, gosh, I have this space in my treatment room and it's this big, or she could ask for a short video, she's the one that is the best to ask questions about for anything pertaining to salt therapy. If you Google salt therapy, you can find out that they're using it with a lot of the very high-end show jumper horses, equine therapy, and they're able to put a mask on the horse. And what they're doing is increasing the physical endurance, and it's shown to work with professional athletes. So we're doing this in a lot of universities and for professional athletic teams, similar to cryotherapy. So I'll leave it up to if there's any questions.
Hello. Thank you so much for that. What a beautiful presentation. So we do have some questions that we have been compiling. The first one is from someone who didn't catch everything you said in regards to children with asthma. They want to know, does the halotherapy room need to have a halo generator in it to have an effect on kids who have asthma?
Yes, it does. And due to the severity of the asthma, it's always good if it's very acute and not just chronic, mild inhaler. It's best to check with your doctor. But yes, there are clinical studies, and you can also go to the World Halotherapy Association as a website, and they have a lot of documented clinical trials about children and asthmatics and indicators to help you understand. The first session may want to be 10 minutes and just once a week, and you could grow your child into doing more and prolonged sessions.
Great. So our next question is, how often would you need to change out something like salt panels or other halotherapy accessories?
Well, as long as there's no sweating truly or moisture on the salt wall behind me, there's really no need to ever change it. If you had skin-to-skin contact, as we know, salt neutralizes bacteria. That's how they cured meat for years and years and years, because bacteria couldn't grow there. But as a second point of contact, we use a hospital-grade disinfectant that has no chemicals in it. It's made from the herb thyme, so there's no toxicity level for an asthmatic or anyone that would have chemical toxicity, and you just spray it and wipe off the salt panels.
Great. So yeah, there is another question sort of in line with that, which is how would you clean a salt room in between clients?
So that's it. Any hospital grade EPA registered disinfectant would work, but I love the one we carry, which is called Decon 30, because it doesn't have any chemicals in it. Again, it's the herb thyme, but it is EPA registered. So I love that anyone that has any inflammatory response usually has a certain toxicity to chemicals.
And you can just wipe it down indefinitely. It's not going to dissolve.
No, it would take years and years and years and years to dissolve. You don't want to spray it and leave it wet. You want to spray dry.
Got it. Well, thank you so much. We are just about out of time. Attendees, please note that any questions that were not answered here will be answered after the session. Make sure you rate and review this session. You can do that directly in the lobby. The icon is right below Ask a Question. Thank you so much, Anne, for presenting for us, and thank you everyone else for attending. Our final session today is Refining the Fitness Experience with Paige Costello, starting at 5 o'clock, and you can join directly from the lobby.
Thank you.
Take care, everyone.